Hello and welcome to the 5th edition of the Real World Dry Eye video series. I'm Dr. Jason Miller, and today we're going to discuss how to bill and get paid for the treatment and management of patients with dry eyes and ocular surface disease. First and foremost, medical management of your dry eye patients is critical for your practice, for your patient's ocular health, and the best visual outcome. Over the course of the series, we've discussed ways of identifying dry eye patients, conducting a dry eye workup, developing a dry eye treatment protocol, and talking to your patient about their condition and treatment plan. Now, let's talk about how to get reimbursed for your time and expertise. So what's the business proposition of doing this? I know many ODs are frustrated in today's insurance environment, so go after these medical patients. It's positive for their ocular health and positive for your business. It makes sense for both. Dry eye is a chronic disease that requires treatment and ongoing management. There is significant prevalence within the general population. In fact, this is the most common pathology you will see for the next 2 decades. 97% of these patients report that their dry eye condition is frustrating and they would like a solution. The barrier to entry is low. There is no specialized equipment required to diagnose or treat dry eyes. You can easily maintain your primary practice. You're just adding a therapeutic opportunity. Now let's talk about how to get you paid. But first, let's cut to something more entertaining than me sitting at this desk. The first and most important step is to obtain your patient's medical insurance in addition to their vision plan coverage. Without this information, you can't move forward. This should be collected at the front desk when your patients arrive as part of the routine check-in process. You will not get reimbursed for both a contact lens visit and your dry eye visit. Whenever you identify a possible dry eye patient, schedule a follow-up visit to deal specifically with that condition. Do your medical exam, diagnosis, and treatment plan at that time. After the magic happens, when you conduct a thorough history, dry eye examination, and develop a treatment plan, you will need to make sure you know what codes to use to get reimbursed. We have a variety of potential codes we can use for office visits pertaining to dry eyes. The first code you need is for the visit itself. These are examples of codes we can choose for that encounter. 99213, 99214, or 92012 are the most common codes chosen for that dry eye visit. Next, you need a diagnosis code for each visit you conduct. That diagnosis code is the ICD-10 code. These codes are chosen based on the patient's specific condition and the severity of their disease. Lastly, you pair that visit code with the diagnosis code and you submit them to the correct insurance company. Here is an example of some diagnosis codes I would use in a typical dry eye exam. Aren't they crazy? There are also times when some patients need additional care and additional codes for their treatment. You can also bill for advanced procedures such as punctal plugs, bandaged contact lenses, and biological corneal membranes. This is simply a matter of selecting the correct additional code. Next, you will need to submit the codes to the correct payer. Remember, there are differences between their vision plan and their medical plan. So in summary, it is not difficult to get reimbursed for your time and expertise. Simply follow these simple steps and you can easily integrate dry eye care management into your practice. So be prepared, understand the disease, and know your protocol. Remember, it starts by obtaining the patient's medical coverage. Don't mix their vision versus their medical care. Choose the right code, submit the codes to the correct payer, and get reimbursed. You can do this. Now you're all set to treat your dry eye patients and get reimbursed for your services. Thank you for joining us.